I am called King Precious, and today we are going to be talking about Mpox. So, this brief presentation will run through the introduction, the epidemiology of Mpox, and we are going to end with the causes, prevention, management, and treatment of the disease. Monkeypox is a zoonotic disease which is caused by the Mpox virus, and it is very similar to the smallpox disease. And there exist two distinct clades of the virus, the clade 1 and clade 2, with each of them subdivided to the subclasses A and B, giving us the clade 1A and B and the clade 2A and B. Clade 1 is mostly occurring in Central Africa and Congo Basin, while clade 2 is seen to be more occurring in West Africa. Clade 1b infects mostly children, while the clade 2b spreads mostly through sexual contact. Mpox was declared a public health emergency of international concern in July 2022, with over 120 countries reporting Mpox cases between January 2022 and August 2024, with more than 100,000 reported laboratory confirmed cases and at least 220 deaths of these confirmed cases. And as of November 10, 2024, the WHO reported 13,699 confirmed cases of Mpox in 20 African countries, including 75 deaths, with the majority of these cases seen in the Democratic Republic of Congo, Burundi, and Uganda. Mpox can be transmitted through two main routes. That is the animal to human transmission and the human to human transmission. The animal to human transmission may occur through direct contact or meat consumption from animals like monkeys, and the human to human transmission may occur face to face, skin to skin, mouth to mouth, skin contact, respiratory droplets, or from a mother to fetus. Initially, monkeypox symptoms resemble the flu. And some of the symptoms may include you have fever, high temperature, which is usually 38 degrees Celsius, severe headache, which is often described as a pounding or a throbbing. You could equally have fatigue, which may be extreme tiredness, weakness, or exhaustion. And you could equally have muscle pain, which could be a pain in the muscles, in the joints, or in the back. You equally have swollen lymph nodes, which could be enlarged lymph nodes, typically in the neck, armpits, or in the groin. And within 5 to 14 days, a characteristic skin rash may equally appear, progressing from one stage to another. And in severe cases, Mpox may lead to respiratory distress, which is severe breathing difficulties. You could equally have septic shock, which are life-threatening conditions. You could equally have organ failure, which is the failure of vital organs. There are several complications that may occur due to the presence of this Mpox virus, and these complications may include secondary bacterial infection, dehydration, skin infection, pneumonia, encephalitis. We can equally have corneal involvement, which may lead to loss of vision and sometimes death in extreme cases. And there are several categories of people who are at high risk of having this monkeypox, and some of these categories include the immunocompromised individuals. We also have pregnant or breastfeeding women, children under 12 years old, people with chronic medical conditions, and men who have sex with men. And we equally have other high risk groups. So in order to know that someone has the Mpox virus, there are several laboratory diagnostic methods that have been put in place in order to detect this virus. And this accurate diagnosis is very crucial for effective treatment and prevention of the disease. So before testing, healthcare professionals collect samples from suspected Mpox patients. And common samples may include lesion swabs, blood samples, tissue biopsies, respiratory secretions. Laboratory diagnostic methods vary, and they may include: one, you could have the polymerase chain reaction, which is the gold standard for Mpox diagnosis, and it detects viral DNA in samples. And some of these PCR methods may include the real-time PCR, the conventional PCR, and the nested PCR. We equally have the serological method as a serology test which detects antibodies against the Mpox virus, and some of these serology methods may include the enzyme linked immunosorbent assay, which is the ELISA, the immunofluorescent assay, and we equally have the Western blot. The next method for laboratory diagnosis of Mpox is the virus isolation, which involves growing the virus in cell culture. We equally have other techniques that can be used to diagnose the Mpox virus or the Mpox disease, which and these methods may include the loop-mediated isothermal amplification, which is a LAM, and we equally have the reverse transcription polymerase chain reaction, the next generation sequencing, and the recombinase polymerase amplification. We equally have the clustered regularly interspaced short palindromic repeats CAS. So all these methods put in place help in the diagnosis of Mpox disease. So understanding the causes of Mpox involves exploring several aspects, including the virus origin, the transmission pathways, and factors that may contribute to its spread. And the causes of Mpox are segregated into the animal to human, that is the animal reservoir, and the human to human. For the animal to human, we could have animals like the squirrels, the rats, the monkeys, the primates, pigs, or even mice. And the human to human, we could have body fluid sexual transmission. And to prevent monkeypox, several measures have been put in place to combat this disease. Firstly, get vaccinated. That is the best way to prevent the spread of this disease. So vaccination against smallpox equally offers some protection against Mpox, and the WHO recommends Mpox vaccination for high-risk groups, like we mentioned earlier. Another way to prevent the spread of monkeypox is by avoiding close contact, by washing your hands regularly, by avoiding contact with animals, and equally take precautions during sexual intercourse. Currently, there is no cure for the Mpox. However, treatment focuses on managing symptoms, preventing complications, and reducing transmission. And some of these management include symptomatic relief, hydration, nutrition, and supplementation. We equally have skin rash and management. We equally have mental health care. And some of these treatment strategies may include patient isolation, protection of skin and mucous membrane. We equally have the use of antibiotics to treat secondary bacterial infections, and also drugs may be considered for the management of this Mpox disease. So thank you very much for listening to this presentation. I will really appreciate if you follow me on LinkedIn and Facebook to watch more videos like this. So see you next time. Thank you.